Please note, this video will represent the informed consent, as you will be asked to sign a consent form indicating that you have watched and understood the following video, which describes the risks of a labor epidural if you decide to proceed with the epidural anesthesia. We believe that you should be fully informed as to all the risks that are present for any anesthesia option. Please bear in mind that this is not meant to scare you, but rather ensure you are fully informed in the event you are undecided about whether you would like the epidural or not. My wife has had 2 labor epidurals, so certainly I wouldn't expose her to unnecessary risk. And in fact, millions of laboring women in the United States receive epidurals every year. Labor epidurals have become the standard of care, but it's still important to be aware of complications so we can quickly take care of any problems related to the labor epidural. First of all, the local anesthesia that we inject in the epidural catheter can cause your blood pressure to drop. Now, this is the main risk to your baby because if the blood pressure drops and stays down for a prolonged period of time, it could cause less oxygen delivery to your baby. This is why we take this issue quite seriously and measure your blood pressure quite frequently after the initial doses of medicine. A drop in blood pressure will usually occur during the first 30 minutes after the first dose of the anesthesia. This is why we check your blood pressure every 3 minutes for the first 30 minutes and then less frequently after that. You can also help in detecting drops in blood pressure if you notice symptoms such as nausea, lightheadedness or dizziness, or shortness of breath. If you experience any of these symptoms after the epidural anesthesia has been started, please alert your nurse, who will then check your blood pressure and notify the anesthesia team regarding any problems with your blood pressure. Low blood pressure is relatively easy to treat with IV fluids and, if necessary, IV medications. A second concern is that on occasion, an epidural catheter will not work properly, which may require the placement of another epidural catheter. Very rarely, the anesthesia can go too high. The problem with a high level of numbness is that it can very rarely interfere with your breathing, and we may need to support your breathing and blood pressure. We have the ability to decrease the level of anesthesia if we need to. If your legs become uncomfortably heavy and numb, we can cut back on the amount of anesthesia, although there is the risk of breakthrough pain as labor progresses. Another aspect of having a block that is too strong is it may interfere with your ability to push the baby out, in which case your obstetrical provider may ask for the epidural anesthesia to be turned off or reduced. Again, there is a risk of breakthrough pain with a reduction of the medication. The epidural block can also cause difficulty with urination, which usually requires the placement of a urinary catheter to drain the bladder. This catheter is usually placed after the epidural anesthetic is working, so the catheter placement should not cause great discomfort. There are rumors about the epidural anesthesia causing long-term back pain. Scientific studies demonstrate that epidurals do not cause a higher rate of back pain. By the way, the most likely cause of back pain and prolonged numbness in your legs or feet is difficult labor and the positioning that goes with that. Another potential risk of an epidural anesthetic is if the epidural needle is inserted a little too deep, which can cause spinal fluid to leak, which can then cause a severe headache. In a worse scenario, this may require another epidural to patch off the spinal fluid leak a day or 2 after delivery. The incidence of headache requiring an epidural blood patch, as it's called, is 1 in 400 patients. Much more rare than headache is if the epidural catheter is placed in a blood vessel within the epidural space. If we inject anesthesia into the blood system, you can develop symptoms such as whooshing in your ear, tingling around or in the mouth, lips, or throat, metal taste of the tongue, or pounding of the heart. If we were to continuously place local anesthesia into the blood system, there is a risk of seizure. The initial dose of anesthesia we provide is a smaller dose used to confirm that the epidural catheter is not in a blood vessel. Once you have confirmed that the epidural catheter is not in the blood vessel, it is extremely rare for the catheter to subsequently enter into a blood vessel on its own. A final risk, as with any procedure that goes through this, is an infection, specifically an epidural infection. The typically quoted rate or risk of an epidural infection is an extremely rare 1 in 100,000. Of course, this would be a serious side effect and could potentially require surgery. The sign of this happening is a persistence of numbness for more than 4 hours after the epidural anesthesia has been stopped, or a return of numbness after a complete recovery of sensation after the anesthesia was stopped. Of course, we take great precaution in creating the sterile conditions that minimize any risk of infection. If you have a significant fever, it is recommended that you receive a course of antibiotics before placing the epidural catheter to reduce the risk of epidural infection. By the way, there is no risk of being paralyzed by the epidural needle, a common myth that's out there. Finally, it is very important that you not have something to eat before. Epidural anesthesia can rarely cause the baby's heart tones to go down and require an emergency C-section. If you have anything in your stomach besides liquids that you can see through, there is a risk of that coming up, going into your lungs, and causing a dangerous pneumonia. This is especially so if you need to have general anesthesia and you are asleep for the emergency C-section. For this reason, we will ask you when you have last eaten or had something to drink. It is absolutely okay for you to ask your anesthesia provider any additional questions that you may have, as we are always available and encourage a well-informed patient. Thank you, and best of luck to you and your family.